Okay, good morning, good evening, good night, all of you. Can you hear me? Okay, can you hear me? Please mute those people who are not. Okay, now what I have done is I have muted all of you because many people. Okay, so now a little bit. We are easy, okay? So if you can hear me well, let me know, okay? We are live on Facebook also. Okay, so we will start now. Is live. This class is live on Facebook page. So if you wish, you can. Good morning, good evening, good night, doctors, nurses, and pharmacists. I am DrChe, and today we will discuss some important writing tips. We will write one complete letter. Okay, we will discuss in detail, and then I will mark your letters. Okay, you can ask me any question at any time. So just let me. Okay, so these are the case notes that you have received already. Okay, so let me allow you. So okay, I'm allowing you to unmute yourself, but only those people who don't have background noise. Okay. So these are the case notes. These case notes can work for both of you, doctors and nurses. Okay. So I have written in such a way that both of you, doctors and nurses, can use for the writing because we cannot take separate classes for both of you. Overall, our purpose is to learn. Okay. So anybody can unmute and talk with me so that we can make our class a little bit interactive. Yes, please. Can anybody unmute? Can you hear me? Can you hear me?
Yes.
Okay. Okay. So someone told me that they cannot hear. Okay, good. So these are the case notes. How much time you will have in the real exam to read the case notes? Can anybody
5
tell me
minutes.
how much? 5 minutes. What you can do in these 5 minutes, please?
We will cluster the details.
Yes, please.
We will cluster the details, important and unimportant, differentiate.
Uh-huh. Okay. What else?
Sir, all detail and which type of letter, transfer letter, refer letter, discharge letter, and all
Uh-huh.
of these, and then we lay out according to the situation.
Yeah, that is good. What else we can do in these 5 minutes?
Scanning, sir.
Scanning, yes, you can do scanning. What else?
Sir, what I understand that when you are getting the case notes, first you have to
Yes.
clear your mind. You should clear your mind. So who is the recipient and what is the date of writing and what is the purpose of writing and what you want to convey the message to recipient. Then you make
Yes.
then you make the part of the writing like recipient, salutation, regard, intro, and the layout whole. Then the end, the sign out at the end.
Okay.
And
It
if
looks a
the
little bit
if
difficult. These things look a little bit difficult, but it's not difficult when you practice and when you practice under guidance and you have good preparation. These things are not difficult. Okay. You can easily get an overview what this letter is about, to whom you are writing, what is the main purpose of this writing. Okay. So these things you can quickly skim and scan. Okay. So if I get this letter in the real exam, yes, useful information. Okay, yes, useful information, important information, less important, not important. You can do about these things. Okay. So for example, if I get these case notes in the real exam, what you can do is, first of all, I will quickly go to the task without reading anything else. I will go to the task. Here my task is, using the information in the case notes, write a letter to patient's general practitioner, DrChe. Give brief history of admission, treatment, and discharge plan. Write letter to this person. Okay. When you are in the exam, you will not, read word by word. Okay. I will just see a letter to patient, general practitioner. Okay. I don't need even name at this place. Okay. If history, admission, treatment, discharge plan. Okay. So what I can understand without reading case notes, what I can understand from this, this is a discharge letter. Yes or not?
Yes.
Yes, sir.
So this is
Yes.
discharge letter. Number one, this is discharge letter. Number two, I am writing back to patient's GP. Okay. These two things I can get from the writing task. What comes in your mind when you are writing to patient's GP and his discharge letter?
So
What
the
should
GP
first
knows
come
the
in your
patient.
mind?
Address.
GP knows the patient very well.
Very good, excellent. Who is there?
Sadaf here.
Okay, okay, good. Okay, so it's good that the GP knows the patient. Why this information is important? Why this
So we,
information is important?
so we don't need to write the past history, medical history, social history because he knows everything.
Yes, the GP knows these things.
It is known case.
Okay, it's a known case for GP. For GP, this is a known case, so you don't need to repeat these information. For example, if patient has history of something that is not relevant to the case, so you don't need to repeat. This is the known case. Okay, the things that is important or not important, we will decide later on. But now you know that this information is. What you will do after this? What you will do?
Read the letter. Read the case note.
Read the case notes. But how you will read the case note? Word by word?
First, quickly scan that, especially the last three discharge plan and what was the admission and all.
Yeah, one more thing, mostly in the writing task, above writing task, they sometimes they give evaluation of, or they give diagnosis and these things here. Okay, but it's sometimes, not always. Okay. Okay, now what I will do is I will start reading from here, but I will quickly read quickly. Okay. So your doctor case notes below. These things you don't need to waste time. Name and address, gender, date of birth. These things you don't need to waste your time on these things when you are reading. Okay. Admission date, discharge date. Yes, you can see the admission date, discharge date a little bit just to get an idea how much time was there in the hospital. This is the diagnosis. This is important. Subdural hematoma. Okay. When you know the diagnosis, sometimes, yes, things can come in your mind that this patient is going back and is, having subdural hematoma and these things. Okay. Now, social background. We don't need to read each and everything in detail. Okay. Just quickly. A forklift driver, works married. Okay. Daughter lives interstate. Okay. So 2 daughters. Cigarette smoking, alcohol drinking, weight. Okay. Hypertension. This is the past medical history. Emergency appendectomy, TIA. Okay, then we have family history. Mother died and father died and mother has hypertension. Okay, so then we have this date. This is the first date when the date is date of admission. Okay, can we decide what is important, what is not important in the in this part? Can we decide now? Not yet, not yet. Let us first read, okay? And then we can, for example, forklift driver, married, these things are not important, okay? So, but let us see, okay? Let us see. First, we will see, okay? Okay, quickly, this is quickly, okay? You don't need to waste a lot of time. So, first, on this date, the admission date, what happened on this time, okay? And at this time, and at this time, sometimes in the real exam, you get questions in which they give time, exact time, okay? And what happened at this, the date is given, but apart from that date, you can see that there is separation of time, okay? Means what happened at 10:30 a.m., then what happened at 10:50 a.m., okay? So you can sometimes see in the real exam, then what happened at 1 p.m., okay? So you can see these things in the real exam. Okay. And then, okay, so let's just quickly see what happened. This patient had a head injury while playing snowboarding, loss of consciousness, weakness in the left arm, slurred speech, all symptoms last 10 minutes. The eyewitness told that by other athletes that these things are, these things were given by other athletes that were participating in the competition. Okay. This happened at 10:30. Okay. Then at 10:50, patient was brought to hospital by ambulance, moderate headache, okay, no weakness, and no slurred speech. Examination, just you need to say abnormal thing, pulse is normal, temperature, these things, okay, saturation, BP little bit high, okay, and then large bruise of 5 centimeter on right parietal region, there is no bleeding. This is examination. Then this is 11 a.m. at 10:50 a.m. Then at 1 p.m. patient becomes unconscious. You can see that patient is conscious here. Okay. So no slurred speech and patient is not having any big issue here at 10:50. But now at 1 p.m. patient is unconscious, is unable to move left arm and leg, complete right hemiplegia. Examination shows this, okay. Pulse is high, temperature, saturation 90%, BP is high. GCS 9/15 is important. Investigation show this on CT scan. And this was the treatment that was given. Admitted to ICU, assessed by neurosurgeon, barhole surgery was done. Okay, within 24 hours. Now this was on 5th, okay. Please mute. Please mute, please. Okay. So then after 5 days, on 10th of November 2022, I have written this sample into 2022, by the way. Okay. So it means I have been teaching OET for a long time, since 2020. Patient's recovery was satisfactory. Patient was shifted to medicine department. Weakness in left arm and leg and improves. The weakness in left arm and leg improves to 4/5. Patient is able to walk with stick and assistance of nurses, and vitals are normal. This is on 10th. Then on 15th of November, patient was referred to physio for physio to rehabilitation department. Individual physio plan made by occupational therapist, speech and language therapist. Patient was able to walk independently, not able to do daily life activities. Examination is given here, and strength is 5/5 now. Continue physio, unable to do daily activities independently. Then on 19th, patient is clinically stable, is able to do daily life activities independently. And now the discharge plan is that we need to continue aspirin 75 milligram once daily, continue physiotherapy at local rehab center twice weekly. And the advice that we have given is stop smoking and decrease weight and resume work after 8 weeks after evaluation of occupational therapist. Now, what you will do this you will do in just 1 to 2 minutes quickly. Yes or not?
Yes, sir.
So you will do this, read this quickly. How you can plan this letter? What comes in your mind? How you can plan this letter? What comes in your mind after reading it? Please mute, otherwise becomes very disturbing, okay? What comes in your mind after reading the letter, okay? Yes, you can select
Because the
relevant
discharge
information.
plan, we have to continue
Yeah.
the all information which is given in the discharge plan. So
Yes.
we have to talk about this.
Yes. The same letter, if you are a nurse, maybe you are writing this letter back to GP, or the same letter with the same information, maybe you are writing this letter back to community nurse, okay? The things will remain almost same if you're writing to GP or if you are writing back to community nurse, okay? Things will remain almost same, okay? Okay. So now, let us start. What you can do is, you cannot use pencil in these 5 minutes. Okay, in 5-minute reading time, you cannot use lead pencil, okay? You cannot use anything. So what you will do is just you will think in your mind. You cannot underline anything in these 5 minutes. You cannot even pick the pencil, okay? You cannot touch the pencil, okay? You cannot pick, you cannot underline anything. You will have these case notes in front of you. You will have answer sheet also, but you cannot write anything, okay? Now start planning, okay? Okay, diagnosis is important, yes, subdural hematoma. Then social background. The GP knows the work of this person, okay? Is married, has 2 daughters, lives. His family lives away. Maybe it is important, but maybe GP knows about that. We will decide it later on, okay? Social thing that daughters live interested. Other things are not important. Cigarette smoking and drinking. Do you think we should write it or not?
Important.
Yes, sir.
I
Only
used
cigarette.
to do one thing, use three things. Number one, take that the information is obligatory or important, too important to skip, okay? You cannot skip this information. Use tick for that, okay? Just tick mark, okay? Cross the information that is not important, okay? And just make a circle that you have to decide later on if you are going to write it or not, okay? Here, I will cross everything except that her daughters live interstate. That could be important because in this patient, social care is important after discharge. Okay. Okay. Next, smoking and alcohol. I think it should be tick mark because this is important. You have to mention so that you can advise he has to stop these things, okay? But still I can keep it in circle, okay? It could be important. BMI is not important now, but you will advise to decrease weight at the end, then it could be. In the past history, okay, let us see if you have decided to decrease any or increase any dose. No. Patient is already taking these medication for hypertension, so I think it's not too important. You can decide later on. Hypertension and its current medication, let us keep it later on. Maybe it is important, maybe not important, okay? Appendectomy in 2018, and there was wound infection, needed treatment with antibiotics. Is it important or not?
No.
No, sir.
No, okay. A TIA in 2021, is it important?
Yes, sir.
Yes, is
Plus
important
minus.
because, yeah, it's related to the current situation, okay? First patient had TIA and now he is having, hemorrhage, okay? Yeah. Family history, patient died of father died of colorectal cancer is not important. Mother has hypertension. It's not important now because you're not diagnosing anything. You're not referring this patient to a specialist. You're sending back to the GP. So family history is not important, okay? Patient is already diagnosed with hypertension, okay? So you don't need to mention mother's hypertension here in this case, okay? Now you have the first date. Here everything is important almost, okay? Patient had a hand injury, loss of consciousness, weakness in left arm and leg, slurred speech, duration of symptoms. Then you will say what happened at next time on this date. I mean at this time. Okay, and in vitals, you will say again examination in vitals, you will say what is abnormal. Okay, BP is a little bit high, you will write this. Pulse is normal, temperature is normal. Okay, respiratory rate is normal. You can write this. The examination was unremarkable except for blood pressure of 130/85. It could be like this. And there is one more thing on examination, that is 5 centimeter bruise. Okay, it looks easy, but when you start writing, it becomes difficult. Okay, then on this date at this time, the patient's condition changes. Okay, and there is examination and GCS no investigation are given and the surgery that was done. All of these things, do you think is important to mention all of these things to the GP? What happened with the patient?
Yes, sir.
Why you are writing this letter to GP? Why?
Rehabilitation, what was the plan?
So you need to tell the patient, first of all, your purpose to write to
For the
GP is,
management.
yeah, not only for further management. First, you need to tell what happened with the patient in the hospital so that you can tell about the further care and the GP can continue further care or community nurse. Okay.
Yes, sir.
So all of these things are important, but when you will start writing letter, you have to make it concise and to the point, okay, and well organized. Then we have this date. This date is important because patient starts recovering, okay, and things are improved, okay. And on this date, you started physiotherapy, okay. Then you have given, examination, all of these things. And discharge plan is important because you cannot skip. All things are important. You are continue aspirin, physiotherapy, local. This is important. Advice is important, and what you need to resume work after 8 weeks is important. All of these things are important. Okay. No, except social history and these things, all other things are important. Almost all the visits are important. There's no irrelevant visit. Sometimes in the real exam, the examiner gives some irrelevant visits, okay? But here in this case, you don't have any irrelevant visit. But if you write each and everything, if you start writing each and everything, 5th of November, 10:30 a.m., then 10:50 a.m., then 1 p.m., then 10th of November, then 15th of November, then 19th, and then discharge plan. Then we need to write the purpose also. We need to write the conclusion also. So these things you can plan before you start writing. So there would be a lot of information. Yes or not?
Yes, sir.
So main issue that you will face in this letter, you will at the end, your word count would be more than 220, more than 200, more than 220, maybe 250, 300 like this. So if your word count is like this, then it is almost impossible to get your required score. Okay. So you have to keep in mind these things. Okay. Now, when you start writing letter, maybe some of you are new here. First, you need to write the greeting part. Greeting part is very easy. You don't need to waste a lot of time. What you need to write? What you need to write?
DrChe, general
Yeah,
practitioner.
you need to write this information, okay? We can even, let us try to copy here. Yeah, I was able to copy here. But how you will write this? In the first line, you only need to write the name of the doctor. It could be complete name, please mute. Someone's, please mute, okay. So if the name is like, okay. If, for example, if name is like this, you have to write the complete name, okay? But here is only one name. You can write only one name. You can see these commas. After name, there is comma, general practitioner, then comma, GP surgery, comma, then address, then comma, then name of the city. Wherever there is comma in the address, you have to write on the next line, okay? DrChe and then general practitioner. Then we don't need commas here. Then GP surgery on a separate line. Then address on a separate line. Okay. Then name of the city. Okay. Done. Any questions so far?
No, sir.
No. Okay, good. Then you have to leave one blank line. This is then next one blank line here. And you have to write date. Which date you will write in this letter? Which date?
Discharge date, sir.
Discharge date. What is the discharge date here?
I think you're on
This
the-
one. Okay.
19/11/22.
Yeah, this date. So you can write like this. One space before, one space after. You can write like this, but if you write like this, name of the month in words, that would be better, but it's not wrong. You can write in any way. Both are okay. Okay, after that, you have to leave one blank line again, and then there. After there, what you need to write?
DrChe.
Okay, there doctor and then name of the doctor. Okay, if the name is like this, okay, like this, okay, Che okay. So then what name you will use here?
Surname, sir.
Surname. What is surname here?
May.
Okay. So you will use this, okay? Like this, there Dr. May, okay? If I change it, then what is your surname?
DrChe.
Okay. So you can get any name. You get any name, but you need to keep in mind this rule, okay? You have to use surname of the doctor, okay? If the name of the doctor or nurse is not given, what you will say? What you will write?
Dear sir, dear madam.
Dear sir, madam, okay? For example, if it is written here, dear nurse, okay? Then you can write here dear nurse or dear doctor or dear sir or madam, okay? After dear, we need to write the name of the patient, okay? Regarding or reference of what patient. Then you have to use name of the patient or complete name here with title, okay? What is the title here?
Miss Emily Brown.
Miss, MS, okay? Mostly in the real exam, you will have this information. You don't need to worry about these things. Some people keep asking, we have to write Miss or Mr. and how you will know if the woman is married or not. And these things you don't need to worry about. In the real exam, you will get all of these things, okay? After regarding this patient, what we need to write?
Age,
Date of birth,
Age
sir.
or date of birth,
date
okay?
of birth.
Okay. If both of them are given, what you will prefer to write? People on Facebook, I can see your comments. You can comment
Age, sir.
below. I can see your comments, okay? On Facebook.
Age, sir. Age, sir.
Age. Date of birth or age. There is no rule. There is no rule. You can write date of birth or you can write age. But what I personally prefer is age. You know why?
We can write aged 52 years.
I would prefer age because for me it is easy, because just what is the purpose of writing date of birth? To know the age of the patient. And when you see the date of birth, you start counting the age, okay, 70, 80, 90, okay, 2000, 2010, 20, so has 52 years. When the age is given, it's easy for me, okay, to see the age, okay. But you can do anyway, you can write date of birth or age, okay. I would prefer age. You can use A capital or you can use A small, okay. Both of them are correct, but preferred one is A should be small, okay. 52 years. Done with greeting part is easy. Now we are going to write the purpose, okay. When I took my exam a long time ago, I used to write this greeting part very quickly to save my time, okay. There is no rule. Their OET is too broad in this case. You can write age or date of birth. You will not lose marks or you will not get extra marks, okay. So this is not a problem, but it should be grammatically okay. And you should mention this.
Can we
Okay.
use it like a general practitioner? We can see, we can write GP, just GP.
Yes, you can write GP, but as we are writing on one complete line, just writing GP would not look good in my opinion. So I have written complete, okay.
Okay,
But
sir.
if you
Thank
write
you.
GP, it would not be wrong, okay. Okay, then you need to write this greeting part very quickly, okay. Then you have purpose, okay. We have to write purpose. What we need to write in the purpose? What we need to write in the purpose?
Introduction of the patient, sir, or his or age.
No,
And,
we don't need to write introduction page, not age. Age is not obligatory. You can mention, you can skip. Two things are important to write in the purpose. Can anybody mention me? What are two
I'm
important
writing
things?
to update the
Yes, sir.
diagnosis.
One is the diagnosis. One is the
Yeah.
Diagnosis, name.
No, these things are just secondary. What is the main thing we need to write in the purpose? Two important things. If you miss
Diagnosis and
one
date
of them,
discharge.
if you miss
Discharge
one
plan.
of them,
Plan.
yeah, if you
So
miss
first
one
is-
of them, you will lose marks.
date of admission with diagnosis and general requests, sir.
Diagnosis with date of discharge.
No. Date of discharge is not important.
Sir, we have to write down what is the diagnosis and what is the reason of referral. What is the purpose of referral?
Yes, sir.
What you want from the recipient. These two things
Yes.
important.
Diagnoses are, I can even say, are issue. Sometimes this is not a diagnosis, sometimes just issue, okay? Diagnosis are issue of the patient, and number two, what we want from the reader for this patient. If you miss any of these two things, you will lose marks in your purpose. And if you get 1 out of 3 in your purpose, you will not get B grade. And if you are a nurse, also C plus is a little bit difficult for you if your purpose is not good. I used to advise my students how the purpose should be. If you see any head news, bulletin of news channels, at the start they have headlines, okay? They just give what happened, okay? The main thing today in, in one accident, this happened, okay? But after at the headlines, they start giving details of the news, okay? Or just in the newspaper, at the start you have a headline, and then you have one column or text after that, okay? Your purpose is just like headline, okay? Yes or no?
Yes, sir.
Okay. If you write a wrong headline, do you think you can attract people to your news?
No, sir.
No. So purpose is very important in OET. Very, very important. And you cannot skip any of these two information. If you skip this information, you will lose marks, okay? Okay. So now let us try to write purpose for this. So you will leave one blank line here. I am writing to mostly I have already one YouTube video in which you can see how to write a purpose. In the char letter, mostly I write update you, okay? So name of the patient is given already above. I am writing to, sorry, update you on Miss Brown. You can use surname only here. Then you can use here a 55-year-old woman or whatever, okay? So you can use age here if you wish, okay? It's not obligatory. You can write, you can skip, okay? Even you can write the profession of the patient, a 55-year-old forklift driver. You can even write like this, okay? A 52-year-old forklift driver. Because my letter is already long, I will try to skip it. But if you want, you can write like this. A 52, then slash, then year-old forklift driver, okay? Like this. You can write like this. But I will not write this because my letter is already long, okay? I'm writing to update you on Miss Brown. Okay. Then what you will write?
Who was
The
admitted or
diagnosis,
has
okay?
yes,
Who
diagnosis
was
or
admitted, you can write who was admitted. But mostly what I like is who has been treated for, then write the diagnosis. You can write who was admitted for also is okay. Subdural hematoma. Okay, let us see the spelling of hematoma. Okay, done. Okay, now she is being discharged today. Because you already know this, you don't need to go to the case notes again and again. She being discharged today, and what we need from the reader, you will see in the task, okay? Okay. Brief history of admission, treatment, discharge plan, write letter to this doctor. So continue, physiotherapy, aspirin, advice, okay. So what do you think, what we need from the reader?
ongoing care
Further
and
care.
monitoring.
Further
Ongoing
care.
assessment and management.
Ongoing assessment management. No, assessment and management is when you refer to someone higher than you. Okay, for example, if you're referring this patient to a hospital, to a specialist, then you will say assessment and management. Here is just further care. Okay, ongoing
Sir,
care,
there
further
is
care.
just rehabilitation plan. I think so. It's a rehabilitation plan.
His rehabilitation plan is further care. Okay, not only rehabilitation. In this case, GP will continue giving this patient aspirin 75 milligram. GP will contact with the physiotherapist to make sure that there is physiotherapy done twice daily, twice weekly. GP will advise the patient to stop smoking and decrease weight. You will also advise, but GP will ensure it, okay? And GP will ask the patient to resume work after 8 weeks, not before 8 weeks, okay? After evaluation of occupational therapist, okay? These things will be done by GP, and GP will make sure these things with further, specialists, okay? Okay. So,
Yes, sir.
and please mute. In your further care would be highly appreciated, okay? What mostly students do is they full stop here and then they start writing a new sentence like this. Your further, she's being discharged today, full stop, your further care would be highly appreciated. This is a very basic style of writing, very basic, and you will lose marks. This is just like, I get up early in the morning, I go to school, I eat at 7 p.m., I go to sleep at 10 p.m., like this, okay? Like primary school student, okay? So if you write like this, then forget about B grade, okay? Or C plus for nurses. So you have to join similar information together to write a compound and good sentences. So this is now compound sentence. There is one mistake in this purpose. Can anybody point out what is the mistake?
Hematoma is with capital H, it should be with a small h.
No, sir. The surgery.
Subdural
It was not mentioned the
hematoma.
surgery. It was not mentioned the patient went under surgery.
So who has been treatment of subdural hematoma is enough, and you can give further detail about what treatment you have given. You have done surgery, you have given medication, so you can give later on in the body paragraphs. Treatment is enough. You don't need to mention exact surgery. That is not a problem.
I mean,
This
I
is
mean,
a
if we are
grammatical
mentioning,
mistake. Just see the grammatical mistake. This is English exam. This is not medical exam, by the way.
So I'm writing to update you regarding Ms.
No,
Brown.
that regarding is okay. On is also okay. On is better one. Regarding is last resort. You can choose regarding if you don't know on is okay or not. Regarding
She
you
has
can write.
been treated. Sir, she has been treated.
For
She
a
know
subdural
after Miss Brown, you should mention who you are referring back to. Miss Brown, who is okay.
Who is recovering from?
What?
Who is recovering from subdural hematoma?
Who has treated, sir?
Who has treated? Very good, excellent. So here, who has treated should be. So
Yeah.
I'm writing to update you on Miss Brown, who has treated herself for subdural. So hematoma, excellent. Okay, who is there?
It's a.
Very good. Okay, very good. So now,
Thank you, sir.
who has treated herself? You have not told me herself. I have just added herself just to make the meaning clear. So you have two sentences here. One is this one, and one is this one. Okay. Which one is correct? Which one is wrong?
The first one is correct, sir. She is already treated by the surgeon. She
By the
can't treat
surgeon.
herself.
Yes. Even if you skip herself, who has treated for subdural hematoma means she is treating herself. She is treating,
sir.
grammatically it means that she is treating herself. Okay. So
Yes, sir.
the patient cannot treat herself in the hospital. Okay. Here active voice is the doctor who is there. Okay. So that doctor has treated her for subdural hematoma, but we don't need to mention that doctor. So you will mention that Miss Brown has been treated for subdural hematoma. Okay. So here has treated is grammatically wrong. Okay. Okay. Anyone else?
For
This,
a subdural hematoma, sir.
for a subdural hematoma, very good, excellent. Okay. Excellent. So for a subdural hematoma. Why? There is
Because
only
it's
one
it is
hematoma, yeah?
one hematoma countable. Yeah.
One hematoma, very good. Do you agree with the doctor or not? Just write in the chat. Do you agree or disagree?
Agree.
Agree,
I
very
agree.
good. Very good. Very good. Anyone else? So, this is wrong. We don't choose article with medical diagnosis, okay? This is wrong. This is a common mistake, okay? You don't need to worry. Here we are here to learn, and using an article with medical diagnosis is a common mistake, okay? So we don't need article. We can use article for a heart attack, okay? And sometimes, but with medical diagnosis, we don't use article. So it is wrong, okay? We don't need it. Anyone else want to mention a mistake?
Sir, subdural hematoma should be in small letter.
Very good. Why?
Because this is the medical condition, so we should write in small.
Medical conditions are not written. All medical conditions are not written in small. There should be some reason. You are true. You are. This is wrong, and you have told that you have told is okay. But what is the reason?
If the diagnosis is if the disease is identified by someone by his name, like Down syndrome, so
Not
they should
identified. The name is given after someone's name, like Down syndrome.
someone name. Yes.
Who can understand this language? Who can understand which language this was? Of which country? Down syndrome, Parkinson's disease. Parkinson's disease. Just remember, just remember, you will only write down P capital, Parkinson, P capital, but the syndrome and disease would be in small, okay?
Yes, sir.
So subdural hematoma is wrong. We should write it in small, okay? Then we will continue. Then we will start with body paragraphs, okay? So before you start writing, you have to decide how many paragraphs you will write. Yes or not?
Yes, sir.
You can write one paragraph for 10:30 a.m., one paragraph for 10:50 a.m., then one paragraph for 1 p.m., then one paragraph for this date, one paragraph for this date. But if you write like this, there would be a lot of paragraphs. Yes or no?
Sir, it will be too long.
Yes,
It
sir.
will be too long. There will be a lot of paragraphs. So you need to
Yes,
decide
sir.
before you start writing how many paragraphs you will write. Okay or not?
Sir, at
And
least two.
how you will
I guess
organize.
I guess 3 paragraphs are enough. First intro
Yeah,
and
that is
the
okay.
second.
That is okay. You will write
Yes.
purpose, you will write conclusion.
Yeah.
These two things are obligatory, okay? Apart from that, you have to decide how many paragraphs you will write, okay? And how which part of the text you will write in which paragraph, okay? What I can do is I can write one paragraph for this date where I will mention what happened at this time, what happened at this time, and what happened at this time in one paragraph, okay? It could be like this, okay? Or you could write these two times together and this one time in a separate paragraph, but it's better to write all these three times in one paragraph, okay? Then write this in next paragraph and then write this in the next paragraph, okay? At the end, you will write discharge plan in a separate paragraph. The last date, today, and discharge plan, you can write together in one paragraph. Okay?
Okay, sir.
Okay, sir.
Yes, sir.
Yeah.
Okay, sir. Thank you.
Okay. So now you have one paragraph and you have a lot of information. You have 10:30 a.m., 10:50 a.m., then you have 1 p.m. You have a lot of information. Here is your real, test. How you will organize information and how you will make things easy and clear for the reader. People on Facebook, I can see your comments, your chat. If you want to mention anything, you can, okay? Okay. So now let us see someone's letter. Dr. Raj is there? Dr.
Yes, sir.
Aida? Dr. Raj is there. Let us see Dr. Raj's letter. Okay. Can you see here the paragraph? This
Yes, sir.
paragraph. This is one paragraph, or you are unable to make paragraphs due to software issues. Or this is one paragraph. Just be honest with us, please.
This is one paragraph, sir.
This is one paragraph, okay. Without reading your letter, are you a doctor? Yes?
Yes, sir.
Yeah. Without
Yes.
reading your letter, I can evaluate you without reading your letter, and you cannot challenge my evaluation. Okay. What should be score for this letter? People can write in the chat, please. What should be score for this? Just imagine if you are in the real exam and you are the examiner, what score you will give to this doctor without reading the letter.
Sir, if the paragraph is long, so it will be boring.
It would not be B, it could be C or C plus depending upon your English, but is not B. For us, for doctors, C or C plus is equal because we fail, okay? C is equal to C plus, okay? Because in both cases, we cannot achieve our B score, okay? So without reading, this is B, this is C or C plus, okay? The reason is you are unable to organize the information in paragraphs, and this is one of the criteria. If you see on my YouTube channel, you can see, assessing criteria for writing. You can watch them. So you have to, what is the purpose of writing a letter? Why you are writing this letter? Why? Why?
To
For the
convey
further
our
care.
information.
To
Patient.
convey your message to other colleague, okay,
Yeah.
other doctor. You are writing this letter to me, okay? Okay. To me, okay? So you have treated this patient, and after treatment, you are sending this patient back to me with this letter. Even your word count is 290 words. Even if your paragraphs are okay with word count, still we cannot get B grade, okay? Okay. The whether purpose of writing a letter, you have to give the information concisely, to the point, only important information, well organized, okay, to the point. Okay. So now let us write paragraph, okay. We can start initially on this date on 05/11/2022. Then you need comma here, Miss Brown, okay. So these things will come, okay. Then you have to see here what you read. There was a head injury while playing snowboarding. There was a loss of consciousness, weakness in left arm and leg, slurred speech, all symptoms last 10 minutes. I witnessed by other athletes participating in the competition. Is it important to mention I witnessed by other athletes participating in the competition? We can skip this information. Yes or no?
No.
Yes.
Yes, sir.
You can
No,
skip.
sir.
We
You
can
can
skip
skip.
this.
This is a discharge letter, okay? So if it is referral
Yeah.
letter, if it is
Then
referral
it could
letter,
be.
yeah.
Yeah, could be
For example, if
important.
you are in the playground or if your GP at that place, this patient comes to you with these things, okay, what happened at 10:30, 10:50, and then at 1 p.m. Then you send to the specialist, then you can mention these things in detail. But now this is a discharge letter. You have to make things concise, okay? So you can skip this information.
Yeah.
Do you think you can skip loss of consciousness, weakness, and slurred speech and the duration?
Loss of consciousness is compulsory, I guess, sir.
Yeah. I think all of the information that is given here is important.
Yeah.
But what you will do, mostly the doctors and nurses, what you will do is you will write like this. On this date, at this time, Miss Brown had a head injury while playing snowboarding. Okay, like this. I will tell you, okay. Because I have marked a lot of letters and I know what mistakes you people make, okay. So you can mention time also. So Miss Brown had head injury while playing snowboarding, okay, full stop. Now, she lost consciousness. Okay. She, maybe you can add something here. She had weakness in left arm. She had
She had
weakness in
weakness
her,
with slurred speech, sir. We can write like that.
yeah, like together, yes.
Mhm.
In her left arm and leg with
Slurred speech.
slurred speech. Very good. Okay. And her symptoms lasted for 10 minutes.
Sir, she lost consciousness. क्या ये lost नहीं होगा?
She lost, yeah, lost. Sorry. Yeah, sorry. Her symptoms lasted for 10 minutes. Okay. Okay, done. Is almost one paragraph. Okay. You can, mostly you will see like this. Okay. What score you will give if I write like this? A grade?
Definitely, sir. A grade.
Yeah, A grade. Yeah, A grade. Yeah. Okay. So this is like, this is very basic level of English. Just I say. So he was playing, he was unconscious, she had a head injury, her symptom lasted for 10 minutes. This is a very basic level of English. Okay. So what you can do to get good score?
Need to use complex sentences, sir.
It's not like complex. When we say complex sentences, they have a specific meaning in English grammar. Complex sentences. Actually, in OET, you don't need to make the sentences too much complex, okay? Because this is an easy exam and you are writing to other colleague, you don't need to go into too much complex sentences. But I understand what you want to say. You should join information together.
Like
Okay,
compound sentence.
like compound a good sentence, join information
Yeah.
together, okay, in a well organized way. Okay,
Yeah.
so what you can do, what you can do is difficult. No, is difficult task. Yes,
Yeah.
a difficult task now to make it concise. Okay, on this date at this time, Miss Brown. Okay, let's copy here. Miss Brown had head injury while playing snowboarding.
Sir, we can write like that.
Yes.
In result of this head injury, she lost her consciousness and developed weakness in her left arm and slurred speech.
Yeah, you're trying well. Excellent. We need to organize a little bit more, okay? Yeah.
Hello.
Yes, please. Let us see what Dr. Raj has written. Miss Brown was admitted on this date with a history of head injury during playing snowboarding. On arrival, she was complaining of right temporal side headache with transit loss of consciousness, left side weakness, which were resolved within 10 minutes after trauma, after about 4 hours of arrival. So a little bit, not well organized. So what I can say here, even you can skip snowboarding and these things, but if you want, you can mention which resulted in loss of consciousness, comma, weakness in her left arm and leg, and slurred speech. Okay, and even you can take slurred speech at the start. So this left arm and leg should be at the end, would look good. Okay, so she had a head injury while playing snowboarding, which resulted in loss of consciousness, slurred speech, and weakness in her left arm and leg. Okay. I will skip this 10 minutes. Okay. Because in the next, we after this time, when you write what happened at 10:50, you can see, okay, there was, no weakness in these things. So it would be clear from that. Okay. You can skip that. Miss Brown had a head injury while playing snowboarding, which resulted in loss of consciousness, slurred speech, and weakness in her left arm or leg. Even you can mention the duration. Okay. Now let me see what I have written in the model answer. Okay. You can see instead of this weakness in right arm and leg, I'm using right hemiplegia. This is not obligatory. If you know, you can write it. If you don't know, you can just write weakness in left arm and leg. Okay. So I just skipped initially and just like on this date at this time, Miss Brown experienced a little bit good language experienced. Okay. A loss of consciousness, right hemiplegia and slurred speech, which lasted for 10 minutes after a head injury. Which one is better, this one or the above one?
Second one, sir.
Second one is better, okay? Second one better. Why it is better?
Because it's
Here
not
you're changing. You just not
yeah,
copy and paste from the case notes. A little bit you are, you are changing your language, okay?
yeah, experienced is
Yeah.
good.
Yeah, experience good. And after head injury, I'm using head injury at the end.
Yeah.
Yeah.
Yes.
Yeah.
It's
That is
concise
fine.
and clear, sir.
Yeah. So you can, see how the things change and then your score changes, okay?
Yeah, and more minimize here.
Yeah, is more concise, yeah.
Yeah.
Okay. So we will take all of this down and we will continue with this sentence, okay? On this state at this time, Miss Brown experienced a loss of consciousness, right hemiplegia and slurred speech. If you don't know the name hemiplegia, you can write or left, whatever it was, okay? Arm and leg weakness, that is also okay. And slurred speech will lasted for 10 minutes. Even I have mentioned here the duration and the head injury, all of these things, okay? But very concisely, okay? After 10 minutes, for 10 minutes after I had injury, okay? Now we should go to the next. Okay. So if you see, I have already, cheated from my model answer. So here is 10:30. We have here 10:50. Instead of writing the time again, you can say after 20 minutes. Okay. After 20 minutes, then you have here. Okay. So this information. Okay. She was brought to hospital by ambulance, moderate headache in the right temporal region. There was no weakness in arms or legs, no slurred speech. Examination vitals are normal, except blood pressure is 130/85. There is a large bruise of 5 centimeter on right parietal region. There is no bleeding. If you write all of these things, your sentence would be very long. Yes or no?
Yes, sir.
Yes, sir.
Yes, sir.
We mention her condition. Okay, okay. Someone is giving suggestion in the comments. That is good. Okay. So now you have to decide what information is important. Okay. She was brought by ambulance. Okay, you can write, you can skip.
Discharge letter, I guess there is no need to mention brought by ambulance.
So last
Yeah,
line,
you can
last line,
skip.
large group of
Yes, you can
patients,
skip.
first admitted.
But then skip
Moderate
this.
headache. Yes, moderate headache is important. This is the only symptom he is having.
Yeah,
And
right hand from
you have to mention no weakness or no slurred speech. But if you have mentioned already 10 minutes there, it means no, he is not having any of these issues. Okay.
yeah.
And
There is
in the vitals, you can mention only the blood pressure because other things are normal. And in examination,
especially we will
bruise is important.
mention bruise size.
Bruise size is important. Yeah.
Yeah. And we could, sir, also mention their vitally stable, vital signs
Yeah.
are stable, and
No, this is
blood
not
pressure.
this is not over a word round. We can say vital signs table. Just I mentioned it.
Yeah,
Good ways. His examination or his vitals were unremarkable except for blood pressure of 130/85. Okay.
And
Yes, sir.
saturation, is it important
Saturation is
also?
98 is okay. It's
Okay.
not any important.
Hmm.
Now let us try, yeah. Let us copy this in, Here we have text and we have to write a sentence, okay. After 20 minutes, okay, what you will write? Let us cheat from Dr. Raj's letter, okay. Maybe he can give us some good. Trauma after about 4 hours. So now he is in 1 p.m. So she was complaining of right temporal right headache and transit loss of, okay. That is also good. Transit loss of consciousness. These things are good. But, you know, we need follow a little bit better. After 20 minutes, if I already mentioned 10 minutes of these symptoms means after this, he is not having these symptoms. So we can say after 20 minutes, she was brought to hospital by ambulance. This is not important. You should skip it. Okay? After 20 minutes, she had moderate right temporal headache. Yeah, you can write like this, right? Temporal headache. Just you can mention all these things together. This is you can she only had, maybe she is not having any other symptoms. She only had a moderate right temporal headache and her no. I want to mention had bruise with examination. Okay. Then I will not add here. She had
Sir,
moderate.
excuse me, sir, can just
Yes.
we write like that? She had moderate temporal headache with the evidence of 5 centimeter bruise at temporal region.
Yeah. That is good. That is a good idea. But what I want to do is I want to keep the examination. This bruise is an examination. I want to keep the examination in separate sentence. I will show you, okay? I want to mention here other symptoms, okay?
Okay, sir.
So she had moderate right temporal headache without, you can say, but no hemiplegia or, slurred speech. Without hemiplegia. Hemiplegia, what is it? Yes, okay. Without hemiplegia or slurred speech, okay? You can write like this. Then examination, her examination was unremarkable. Even blood pressure is not too high, 130 by 85, not too high, unremarkable. Instead of examination, her vitals were unremarkable. Her vitals were unremarkable. Then you cannot add examination here, okay? her examination showed or revealed a 5 centimeter bruise on right parietal region and her vitals were unremarkable. Okay, it looks good like this. Okay, with bruise you can use article her examination showed or revealed a 5 centimeter bruise on her right parietal region and her vitals were unremarkable. Okay, anyone wants to give any suggestion? Okay, so here if we compare here, sorry. So here you have in the model answer I have after 20 minutes she had a moderate headache. Even I have not mentioned. Oh, okay. So I'm mentioning parietal region but not region of headache. Okay. She had a moderate headache and a large bruise of 5 centimeter on her right parietal region. Okay. I have skipped even examination because most of her things are normal because she is not having slurred speech, not having any hemiplegia, these things, just to make it concise. If you see here 19 words here and we have here 29 words. So we have 10 words less here. But if you write like this, is also not wrong. Okay. After 20 minutes, she had moderate right temporal headache without hemiplegia or slurred speech. Her examination showed a 5 centimeter bruise on her upper region and her vitals were normal. Okay. Okay. Any question? Anyone want to mention anything? Vitals are normal. You can skip. Okay.
Okay.
You can even write like on after 10 minutes, after 20 minutes, she had moderate right temporal headache without hemiplegia slurred speech. You can skip vital signs. And her examination showed this bruise on her right temporal region. Okay, like this. 50 words. Okay, any question? Anyone? All good?
Yes.
No, you can continue. No, you can continue next. Next, okay. Next, this part in the same paragraph, or you can start a new paragraph, okay, as you wish. Okay, at this time, patient became unconscious. I'm using is, but you will not use present tense in the letter because here in the case notes, you can use present tense because you are writing case notes at that time. Unable to move left arm and leg, complete right hemiplegia. Examination pulse is 120 and BP is 150/85. GCS is 9/15. CT scan is important here to mention. The treatment is important because this visit is important this time. So it would be better if we start a new paragraph, okay? So how you will organize this paragraph? So here you have 1 p.m. unconscious and unable to move. So instead of writing unable to move left arm and leg, you will use medical term complete right hemiplegia because you are writing this letter to a doctor, okay? In examination, you can skip pulse, temperature, and rest. You will only mention blood pressure and pulse if you wish, okay? GCS is important to mention and CT scan result is important. And the surgery is important to mention, okay? But the problem is how you will mention these things, okay? Let us cheat from Dr. Raj's letter, okay. Okay, after about 4 hours, okay, okay, like this is one paragraph. He is writing all. After about 4 hours of arrival, her symptoms were worsened. You can see the language. Were worsened with. Can you hear me? Just I'm talking and nobody is responding. Can you hear me?
Yes, sir.
Yes.
We are.
Okay,
Yes, sir.
thank you. So her symptoms were worsened with loss of consciousness and right hemiplegia. On assessment, her GCS was this, blood pressure this, and pulse this, and respiratory rate this. You can see how it becomes a little bit difficult and not well organized. Her CT scan, no, her CT scan revealed this. After evaluation by neurosurgeon, she underwent emergency bowel surgery on this state. Okay, so we need improvement. Yeah. PM. With time, just remember, with time you will use at. With date, exact date you will use on. Okay. At this time, then what you will say?
She deteriorated and became
She deteriorated is also okay, but you can directly write Miss Brown became became unconscious. Miss Brown lost consciousness. Then you can join next thing with right hemiplegia. Okay, lost consciousness and no, you can directly Miss Brown lost consciousness with complete right hemiplegia. Okay, yeah, like that is enough. So in examination, we just mention our examination.
On examination.
Revealed. Yes, please.
Can I say on examination? On examination.
On examinations, okay. Her examination is okay. Both are okay. Her examination revealed blood pressure of 150/85 and GCS level of 9/15. Okay. So I'm joining two information together. It looks good sentence. It's not bad. Then CT scan and the treatment you can join together. Okay. Our CT scan shows massive epidural hematoma. Our CT scan showed. You will
So
use
shouldn't
past
we
tense.
mention
Showed.
false, sir?
Yes, please.
So shouldn't we mention false?
No, this is discharge letter. If you start mentioning each and everything, your letter will be too long. Okay, it would be more than 220 words. Okay, you need to be a little bit concise here. Write the most important things. Okay. Our CT scan showed massive epidural. You will write in small epidural hematoma. Yeah, spelling is okay. Hematoma. No treatment, admitted to ICU, assessed by neurosurgeon, bowel surgery done within 24 hours. Out of this, what is most important thing?
surgery to surgery.
Surgery, okay.
Yeah.
Or you can say for which bowel surgery was done within 24 hours. You can say like this. Or which was treated with bowel surgery within 24 hours. Both are okay. For which? This is name of surgery, you will write in capital. Okay, done?
Yes, sir.
Okay.
Yes, sir.
Now you can delete it. So far we have 117 words. We still have 100 words. Okay. Okay, case notes, let us go next. Now, if you see, can you make a complete separate paragraph for this visit? For this visit? I think no, this is not too important. Just patient is improving. You can join this with the next, okay? Will look good, okay? Because you already have 2 paragraphs. On this date, patient recovery is satisfactory, shifted to medicine department. Weakness in left arm and leg improves to this, able to walk with stick and assistance of nurses, vitals normal. Out of this, what we will write important? What is important?
Step down to medicine ward.
On this date, you will use name of the patient at the start of each paragraph. Miss Brown's condition was improved. Shift to medicine department. Let's no need to mention weakness in left arm and leg improve. Okay, so what I will do is Miss Brown's condition was improved as no, you can directly write Miss Brown's weakness. No, sorry.
However,
As
Brown's condition was
as
improved.
her
However,
yes. However, no, was improved as her weakness in left arm and leg was 4/5 and she was able to walk with a stick. Okay, just with a stick or help with the nurses, you can mention these things. Okay, let's see a little bit in better sentence in the model answer because I written this a long time ago. Okay. Yeah, this is just one sentence here also. Let us compare. Okay. On this date, Miss Brown had less weakness and was able to walk with a stick and assistance of nurses. Okay. So I'm not mentioning exact the weakness. Okay. Miss Brown's condition was improved as her weakness in left arm and leg was this, and she was able to walk with a stick. Okay. This is okay. It's not wrong. It's not bad sentence. But if you see here in the model answer, I have written it better. So when I'm writing model answer, I'm a little bit in, I'm joining, I'm thinking, a lot of things happening all the time. Both of sentences are good, but which one is better? This one, yes? Okay.
Yes,
Miss
sir.
Browns had less weakness and was able to walk with a stick and assistance of nurses. Okay. So now you have next date. Okay. So I've written this complete visit in one sentence. So this is after 5 days. She was referred to physiotherapy for rehabilitation. Individual physio plan made by occupational therapists, speech and language therapists, able to walk independently, not able to do daily life activities. Examination is okay. Vitals are normal. Blood pressure is normal. Muscle strength is normal, and she was advised to continue physiotherapy until she is able to do daily life activities. In this visit, what is important? What is important in this visit?
Her condition has improved, sir.
Yeah, that is okay. This is already mentioned. She has less weakness in these things. After 5 days. So
She was
you will
referred to
mention
the
that she was referred to. She
rehabilitation
referred for
department.
physio. You will not write physio. You will write physiotherapy to rehabilitation department. You don't need to mention rehabilitation department. Individual physiotherapy made by occupational therapist, speech and language therapist. You don't need to mention all of these therapists. Okay, able to walk independently. This is important improvement because now here she was walking with assistance. Now she was able to walk independently. Okay, but
Sir,
she was not.
we can write here that she
Yeah.
recovered. Sh- uh, yeah, her mobility was improved.
Yes, yeah, mobility was improved as she was able to walk independently. You can write like this.
Yeah.
What else? Okay, after 5 days, she was referred to you need to write the name of, if you write name of the department, you need to write in capital to the rehabilitation. Rehabilitation. Rehabilitation department. OET likes the names of the emergency department, rehabilitation department in capital. They like it. But if you write small, it's not wrong. Okay. She was referred to the rehabilitation department for an individual physiotherapy plan you can stop here. She was able to walk independently because I now want to add her daily life activities is important. Okay, she was able to walk independently, but
Need assistant in her daily life.
yeah,
However, sir,
yeah, we
however,
go. However, yeah, yes.
however, not able to.
So able and able, I want to avoid the repetition. She was able to do, but I will not say she was unable to do this because there would be repetition of unable and able. Okay, this is the language.
I guess whoever is best,
Yeah,
whoever instead of but.
yeah, but however, that is not a problem. She was able to walk independently, but couldn't or could not. You should not write, this apostrophe, but could not do. So I want to avoid able and unable, but could not do daily. Or you can say, but needed assistance for daily life activities. You can say like this, okay? But needed assistance for daily life activity. This also good. Someone is saying on Facebook, could not do daily activities. Yeah, that is also okay. I would prefer instead of could not do, but needed assistance for daily life activity. This is a little bit more, formal and good language. But in assistance for daily life activities, you can skip muscle strength, vital. These things are normal. Okay, you don't need to mention. You are going to mention the important thing. Okay, she was referred to the rehabilitation department for an individual physiotherapy plan. She was able to walk independently, but needed assistance for daily life activities. Looks good. Okay. No is today. This date is today. Okay. 19th. This is today. Okay. So you will not write the date. No. Today she is clinically stable, able to do daily life activities independently. This you can mention, okay? Today, Miss Brown is clinically stable and is able to do daily life activities independently. Okay. Okay. Now you write discharge plan. You cannot write, for example, you cannot write one paragraph, one line here, and then start discharge plan on the next line. No. You will continue discharge plan here. Okay. Okay. So let us copy this discharge plan and we will convert into sentences. First of all, see this discharge plan. Everything is important or something is important, something not important. Aspirin is important. Continue physiotherapy at local rehab center twice weekly is important. Stop smoking and decrease weight is important. Resume work after this is important. Okay. But issue is how you will convert it into sentences is important. Okay. This is important. Okay. How you cannot write one sentence for all of these things. It would be very long sentence. Okay. You have to organize. How you can organize? If you see this is related to a little bit about treatment. Okay. Yes or no?
Yes, sir.
Yes, sir. Yes, sir.
This is related to a little bit about treatment, and this is the advice. And this is advice. Yes or no?
Yes, sir.
Yes, sir.
So even it is written here. Yeah, this is advice. This is advice, and this is the treatment. Okay. This is a big issue because when you are in the real exam, you don't even have time to think and do these things. Do it now. Practice it now, because in the real exam, you should be well prepared and you should do these things very quickly. Even in my exam, in the last 5 minutes, I had almost 1 or 2 paragraphs to write in just 5 minutes. I wrote it very quickly. At the start, I was thinking, I was planning, I was doing this and that, everything. But in the last 5 minutes, I had very short time and I wrote last 1-2 paragraphs very quickly. Okay, so it's important, but still I got 400 in writing. But it's very important that you plan things before and practice well. Okay, so how you will convert it into sentence? This is important thing. How you will convert it? Otherwise, you will use she is being discharged on aspirin. You will write small because this is generic name, 75 milligram once daily, or you can write even OD. Once daily is also okay. Once daily. She's being discharged on aspirin 75 milligram once daily and should continue physiotherapy. You don't need to rush at local rehab center, okay? I should continue physiotherapy twice weekly. Okay, it like this is okay. Or if you want to mention, can we write these two visits to all together? Which visits? Tanzila Rahman, which visits? Okay. She is being discharged on risperidone 75 milligram once daily and should continue physiotherapy twice weekly. Yeah, that's enough. No advice. How you will write the advice? Let us see in Dr. Raj's letter. Reported dramatically improvement. Okay, this I think you have already done, Dr. Raj, IELTS or something, because these words are not needed in OET, dramatically and these things. Okay, so while progress, she was able to work independently but was unable to do. Okay, she is being discharged today with the device of this. No, we need improvement. Okay. Other sentence, how you will write other sentence? Second sentence. Can anybody just mention me quickly? Dr. Buffrin? Anyone else?
Sir, we can write like that. Health teaching has been given regarding smoking cessation and weight reduction.
Yes, it's good. It's good, but you can use the word advised. So she is advised. She is advised to stop.
Kindly advise to stop smoking.
Yes, please.
Kindly advise to quit smoking and decrease weight.
Yeah. She is advised to stop smoking and decrease weight. Okay. Resume work after 8 weeks after evaluation of occupation. So let us start. Okay. She is advised to stop smoking and decrease it because we cannot make them more concise. Decrease weight. Now we have to think either whether we want to write this evaluation, resume work after 8 weeks in the same sentence or in the different sentence. It depends upon you. Okay. I can even put comma and she should. I don't want to use advise again. She should resume her work okay. She should resume her work after she should resume her work after 8 weeks after evaluation of I want to avoid a repetition of after and after, but it will take time to think. Okay. She should resume her work after 8 weeks.
Following
Then,
evaluation of occupation.
yeah, for very good, very good. Following, very good. Following evaluation of occupational therapist. Can you see this comma and this dat? I am using this comma because no, I have already used and here. So I cannot start and here again. It would not look good. I can use comma and then start and. It will show that this sentence is a little bit separate. This is not a separate sentence, but this is a little bit separate from the rest of the sentence. This is a bit high level of English, but you can do it. But if you wish, you can full stop here. You can start a new sentence. That would also be not any big issue. Okay. Now done. Now you have to write the last sentence, the conclusion. I would be grateful. Mostly I use in light of the above, I would be grateful because our letter is already long, I think so. So I am skipping in light of the above. Let us see the word count. 221 is already long, okay? I would be grateful if you could further take care of Miss Brown, okay? Yes, you can do like this. $230, even we have tried to make it too concise, but still it is 230, okay? It's still
Sir,
long.
excuse me, sir, what's our word count limit?
Word count limit you can write between 180 to 220. But in OET, they have not, fixed rule. If you are word count little bit high, little bit low, overall, you should be concise. You should not write irrelevant information. But still, we can make it concise, less than 220. It is possible, okay? Yeah, I will show you model answer, which is less than 220, okay? 210. No, I have not written here the conclusion. Let us add here conclusion. $223 is okay. 223 is okay. Is okay. But overall, you should be concise, okay? If there is a little bit difference of word count, must be in present tense, today's visit. No, today's visit, you can write in past, in present, that is not a problem. But try to be, consistent with one. Means if you write one, present or past, try to be consistent with present or past, okay? Don't try to switch. Some sentences are in present, some sentences are in past. In today's visit, try to be. Dr. Aida is here. Dr. Aida. Dr. Aida is here or on Facebook with us. I want to mark her letter. No?
Sir, can you please send us your sample letter, please? This
Sample letter, you can text me on my WhatsApp. I will send you.
Okay, thank you, sir.
Yeah. Okay, so Dr. Aida is there? No? Mr. or Dr. or Yasin is there?
Yes, sir. Yes, sir.
Okay. So first we will count the word. This last sentence is not included in the word count. 351, good try. Oh no, 350. I was thinking 250. 350. Let me see as doctor, nurse. Yeah. So what he is doing is he is just reading the paragraph and converting it into sentences. Okay. I will show you. Okay. And you need to improve your greeting part. I have already, mentioned about these things. This letter is being written regarding your known patient. You don't need to say that a known patient and miss anyone who was admitted to our hospital on this date with the diagnosis of subdural hematoma. Okay. How many? 28 words. Okay. 28 words. And let us copy here 28 words. And here we have just 16 words. It's almost double, okay? Yes or no?
Yes, sir.
This is conciseness, okay? The same message I am saying, I am writing to update you on Miss Brown, who has been treated for subdural hematoma, okay? Subdural hematoma, S and H should be small, okay? So the same thing you are writing in 28 words. So this is conciseness, okay? Okay. Now she is ready for discharge back into your care today. That is okay. I mostly prefer what you want exactly. You should mention a little bit, okay, in detail. On admission, Miss Brown complained of moderate pain in her left temporal region. This just one symptom, okay? You can see just one symptom. During the examination at 10:50 a.m., she exhibited no weakness in her. No, he is not saying anything about weakness at that time. Hemiplegia is not mentioned anywhere, okay? Loss of consciousness is not mentioned. So skipping a lot of information in first visit, okay? And time is not mentioned, date is not mentioned, okay? During the examination, on examination at this time, she exhibited no weakness in her arm or legs. There is no mention she had weakness, and now we're saying she has no weakness. Okay, you can see how we make things confusing, okay? All vital signs were normal, however, she displayed a rash bruise. Displayed is not good. Displayed is not a good word here, okay? Approximately 5 centimeter size on her right parietal region with no signs of bleeding. So you can skip some information here. My son is there, just waiting to come in the room to sleep after class. Yeah. Okay. Okay. So you can improve this sentence. Okay. Upon assessment at this time, she was unconscious and unable to move her left arm and leg due to complete right hemorrhage. This is a good sentence. Her vital signs included. This is not included. This is not good. Okay. And you can skip here. Less important. For example, tachycardia, you can skip. Just write the blood pressure, Glasgow Coma scale. You can make it more concise. A CT scan revealed a massive epidural hematoma for which emergency Barhol surgery. Barhol surgery should be in capital in comma because is name of a specific surgery. Was performed within 24 hours. She spent 5 days in the intensive care unit. This sentence is not too important. You can skip it. Okay. This Miss Brown was referred to rehabilitation department for physiotherapy. Very simple sentence. You can add some extra information here. Okay, to make it, a little bit better sentence. An individualized physiotherapy plan was created. Created is not good word by occupational therapist. So you can be concise here. Her muscle strength in the left arm and leg has improved. This is a mistake. No, we don't know. You started about 15th of November, and now you are talking. We don't know this is about today's visit, or you are still in the 15th of November. So this is grammatically vague. Okay, I would not know this is today's visit or 15th of November. Okay, be careful. She is clinically stable and able to independently perform daily life activities. As you know, we don't need this all information. Just skip it. Okay, this paragraph is unnecessary. Information would be greatly appreciated if you could continue Miss Brown on aspirin, this and that. Rehab, no, we don't use complete words. We don't use short form, rehabilitation, physiotherapy, okay? Just improve, please. Overall, you need a lot of improvement. But the way I have explained, I think you can now write a good letter, yes or no?
Yes, sir.
So you will rewrite this letter. You will rewrite this letter. You will send me again, okay?
Okay, sir.
I will mark your letter. Raj is already. Yes.
Sir, what about the closing of the letter? We didn't discuss about it.
Yeah, I have written closing. I would be grateful. I would be grateful if you could further take care of Mr. Brown. That would be fair in this. If you want in detail, there are on YouTube channel, I have explained how to write conclusion, how to write purpose, these things, but now we have short time. Raj, you need to improve your word count and then your paragraphing. I am writing to update the current health status of no, just be simple and easy, please. Okay. Hematoma on this dates are not important. She's being discharged today. No, just compare the balance. This sentence is too long, okay?
Okay.
And the next sentence is short. This is not good, okay? She's being discharged today. You can bring into in the next sentence, okay? So was admitted on this state with the history of head injury during while would look better while playing snowboarding. On arrival, she was coming over headache, loss of consciousness, left, okay. Lights and weakness, which were resolved within 10 minutes of trauma. You can make it better, okay? As we have already explained, okay? For arrival, her symptoms, we need one comma here. Her symptoms were worsened with loss of consciousness and right time. Please on assessment. Her GCS was this. This is okay. After evaluation, neurosurgeon. So you don't need to mention each and everything, okay? Because it becomes too long, okay? You can see here, you're mentioning a lot of information. Recovery was satisfactory. Ignis improved to this, okay? Your English is not bad, just you need to be a little bit concise, okay? Be concise. Mr. One reported a dramatically don't write these words, just our condition was improved, okay? On this day, she is able to do daily life activities. She is being discharged today with advice of weight reduction, smoking cessation, continue. Continue, no, this is first form of verb. Here you are using, nouns and continuation of maybe like this, okay? Or you can say, and should continue. Yeah, local rehab, no, rehabilitation center twice weekly, and aspirin. Aspirin should be small. Overall, Dr. Raj, your English is not bad, very good. You can easily improve. Okay. If you can rewrite this letter, that would be great. Okay. Sachin nursing letter is there, Miss Sachini? Is
Yes,
there?
sir.
Are you
Yeah.
there?
Yes, sir.
Okay. It's too short letter. You don't need commas and these things in the greeting part. I have already explained to you. Okay. Okay. Miss Emily Brown, the word count is 140. Very concise letter. Very good. Excellent. Okay. But it's too concise. We should add at least 180 words. Between 180 to 220 is okay. Mr. Brown was admitted to our hospital on this date with an accident, which resulted with a hand injury on admission. So you have not written any purpose, okay? So you should write a separate purpose. I already told you where you should mention two things: what is wrong with the patient and what do we want from the reader, okay? The patient complained of, don't use these short forms, just write complained of, okay? Thus condition is weakness in left arm and start speech. CT scan, her CT scan, okay, was done and the results showed a massive apparent. If you improve this paragraph a little bit, and you add the purpose here, let us add purpose here. Because there is no purpose in your letter. Now it looks good, okay? Purpose, and then you have this little bit concise, paragraph. Just improve a little bit more, okay? After admission to the ICU, okay? Admission. I think she was assessed by a neurosurgeon. Neurosurgeon should be small, okay? The bar hole surgery, you should put comma after and below before bar hole, okay? Surgery was done. After a week in ICU, she was stabilized, and she has stabilized. No, her condition was improved, okay? Would look better. Problems, no, this is in formal language. No, this her conditions are improved, and just write her weakness has improved like this, okay? She still need is grammatically wrong. She still needs, okay? She still needs to do. She still needs to continue physiotherapy. It has to be continue also grammatically wrong until she is able to. So just write the good discharge plan. Emergency needs to do physiotherapy at the local rehab twice weekly and continue physiotherapy. Furthermore, we don't use furthermore in OET. Okay, you need a lot of improvement. The way I have explained you, I think you can easily now rewrite your letter. Yes or no?
Yeah.
Please rewrite the letter and send me. Okay, I will evaluate you again, individually, not in the class. Okay, individually. Okay, thank you so much. So if anyone need any help with writing and speaking modules, you can text me. We have individual classes available, and in the comments below on Facebook and on YouTube channel, you can see my WhatsApp number and link to my Facebook page. You can text me or you can like the page. And thank you so much, everyone. Those people who are on Zoom with me, I will mark if there is anyone's letter on with me, I will mark, but I will stop now the recording. And thank you so much. You can subscribe to my channel and you can like, share, and do these things as you wish. Okay, thank you. Okay. Okay, now and let us go offline. Okay. And let me go offline from Facebook. Just 1 minute. No. Let me stop. Just 1 minute.